Hi everyone, this is Kate Warnock, GuideWell Social Media Manager, coming back to you live from MediFuture. And today with me in the GuideWell Insights Lounge, I have Dr. Grace Terrell. Dr. Terrell, welcome to the GuideWell Insights Lounge.
Much.
Dr. Terrell is the CEO of the Cornerstone Healthcare, as well as a practicing internist. So we're so glad to have you here, share your thoughts with us. You have very long and deep roots in North Carolina, and with your practice of medicine, I am sure that you have seen the healthcare market change over the course of your career. What have you seen personally, and how has that impacted how you practice medicine?
Absolutely. So I do have long roots. I grew up in a rural area of North Carolina and can remember from the early 60s where it was very rural and there was little country doctors and general practitioners, small hospitals all over the state. I trained at Duke and at Wake Forest Baptist Medical Center in internal medicine, and then joined my in-laws in practice in 1993, who had been general internists in practice for years. And that was a very, very different time in medicine. The doctors in general internal medicine did everything. We went to the hospital, we did primary care, we went to the nursing home, we were on call, we did lots of procedures. But it was a time when the economics were changing. It was when in the early 90s, HMOs were coming. There was a lot of financial pressures that were on the manufacturing industries that was the center of our community. Sure. Furniture industry practice in High Point, North Carolina. And so we were thinking about healthcare reform back then. This was the era of the Clintons, where they were trying to look at the cost of care. So my organization was formed, which is Cornerstone Healthcare, in the middle of that in the 1990s. Two or three of us got together, and soon it was 42, and we formed a multi-specialty medical practice. And I think that we thought that we were going to fight the insurance companies, and it was all about us, and it was all about trying to preserve something. Well, if you go from there to where we are now, it is an entirely different healthcare environment. So Cornerstone Healthcare, it's a multi-specialty medical practice that now has 380 providers throughout a 12-county region on staff at multiple hospitals. We have a strategic affiliation with Wake Forest Baptist. What we see in the rest of North Carolina is similar, where there's consolidation in large organizations that are forming clinically integrated networks. There is far more focus now than there were a few years ago on understanding the continuity of care. Everything's wired, so we have electronic health records throughout the state. A lot of what I used to do in practice is very, very different now. So you have hospitalists, you have primary care that doesn't go to the hospital. What we've been doing in our organization is actually working very, very extensively on what we think the future is going to be, not over the past 20 years, but in the next 10 years, and really focus on new care models that are focused on new patient-centric ways of delivering care in the setting of changes in the way that we're paid, as well as within the context of information integration.
So Dr. Terrell, there's been a lot of conversation we've had up to this point around the consumer, and the consumer being at the center of new care delivery. One thing I want to really kind of talk to you more about, though, is from the provider perspective. Being a practicing internist your entire career, and the networks you've put together yourself, I think that I've seen lots of evidence of some dissatisfaction among the provider ranks as to the declining role that they might be feeling they play in the care delivery, just dissatisfaction overall, perhaps with having to do a lot more paperwork than actually practicing medicine. I'm wondering, do you think that team-based care, as well as that idea of a physician leader, might be a solution to some of that dissatisfaction that providers are feeling?
Well, the change is never easy, and if you were speaking to physicians in my organization right now, you would find some that were as anxious and unhappy as anybody else in the healthcare field right now, because we're going through an enormous transformation of care that is going to be far more focused on consumers and patients and less on what I call the tyranny of the 15-minute office visit, where it's all about the doctor and the doctor's needs and not so much about the patient. So it's difficult. It's a difficult transition when it comes to electronic health records and putting together new sources of things. Now, having said that, the physicians in our organization that are leading our teams in our advanced care models are some of the happiest practicing physicians that we have. It's focused upon a team that includes not only in our polychronic clinic and our special clinic for our Medicaid patients, but also for our cancer patients and our heart patients, and soon our chronic obstructive pulmonary disease patients. It's a physician-led team that includes nurse practitioners and behavioral medicine and social work and pharmacists. Right. And they're really very, very much focused, not so much on the office visits anymore, and not so much on the old payment models, and they have time to really, really get into the patient's needs. It's what we all went to medical school to do anyway. Right. And one of my partners, Dr. Richard Orr, is leading one of our care teams. And he said to me not too long ago, you know, this is the way I wanted to practice medicine my whole life. I just did not think it was possible anymore. And so I think the message for physicians right now is, even though change is hard, the bottom line is that that what can be possible on the other side, if we really start focusing on the consumer and patient's needs, is actually going to be a very rewarding aspect of healthcare.
It seems to me that the physician extender, so the team that makes up the team-based care, really has freed the physician to, as you said, practice the kind of medicine that they've been wanting to practice the entire time. Why do you think it took us so long to arrive at this kind of model?
Well, our economic model for healthcare has been based on paying for widgets. And so, you know, it's essentially, the motto is that whatever the thing is that you do, the more of it that you do, the more revenue you have. So the pressure that has been placed on physicians as a result of that has not to invest in things that are actually more expensive, such as care teams, but to actually invest in capacity and volume and procedures, because those were the profit generating aspects of a fee-for-service payment system. So until the payment system and the new payment models were a possibility, and quite frankly, until we had a level of information sophistication that has been, you know, brought forward by technology in the last few years, it's been a very, very difficult economic model for the average physician to really get and grasp what the possibilities are.
Right. Well, right on the heels of that, then, as the CEO of Cornerstone Health, you're clearly involved with, you know, the fundamental, you know, flow of information is just essential to team-based care. You have to have the right information at the right time. Yet a robust IT infrastructure comes at a cost. Yes. And so you have to balance, I'm certain in your role, the mandated requirements, something like ICD-10, where you have to change coding, you have to change your systems, along with, you know, investing in new technology. How is it that you're able to strike that right balance, where you're covering the bases without feeling like you're sacrificing where you want to put your money, which is in the medicine?
Sure. Well, you know, most industries spend more of their annual revenues on technology than healthcare has, and has for a long time. So if you looked at a healthcare company from 10, 15 years ago, less than 3% was what was actually spent from an investment standpoint of overall expenditures. So as high tech came in 2009, and a real significant amount of externally driven change to basically tell the healthcare industry that they had to really have more value through having information integration and exchange. We sort of entered the aspect of investment in technology behind the 8 ball, and one that was being driven by regulators as opposed to us ourselves. So my organization actually went on electronic health record in 2005 and made that investment early on and got some benefits from it. What is happening now is that there are increased costs related to regulatory burden and many of the things that are being in place, and it's not easy to make those investments, but we absolutely think it's crucial. The aspect of technology costs will likely be with the healthcare industry for a good while, and it's not been commoditized yet such that it can scale. Right. So partly as the industry sort of has more mature technology from a population health management standpoint, some of these issues will settle out. I talk about health information within 5 different stages, and stage 1 has been around for 30 years, and it's been mature technology for a long time, and it's related to practice management systems, revenue cycle management, scheduling, billing and collecting, because that was sort of the basic block and tackle. The second stage is what we're in right now, is electronic health records and clinical decision support, and it's still very focused on transactional medicine. And we're still probably only 30-40% into the mature technology and those costs. Population health management, which is where the industry is going, is still just in its infancy when it comes to the products that are available and the investments that are being made. So that would be the third stage, would be population health management. A fourth, which this conference has been talking about quite a lot, is the information that's going to arise out of the consumerist movement, where the technology is taken out of the hands of the providers and actually placed in the hand of the patients and consumers. So the smartphone will revolutionize healthcare just like it has everything else, and it'll be a good thing. But we as an industry have not figured out yet what that means to us. We'll learn pretty soon whether we like it or not. And then the fifth stage, which, the big words for it are the big genomics, personalized medicine, big data, is on the horizon. I don't think it's hit at all the consciousness of the typical healthcare company, but it will, because it will have enormous potential benefit at the patient at an individual level. And our current business models and infrastructure is not particularly well placed to understand how that will impact us. So as far as the cost of technology, I just think it's the way it is what it is as it relates to business. And if you don't invest in it, you're going to end up having those that do invest in it basically derive the value from the current systems.
Right, right, which is harder to do every day, I'm sure. So
absolutely it is.
Well, so you had mentioned some things you've heard here at MediFuture. I'm wondering, what are some of the aha moments you may have had, or some takeaways that you've accumulated so far today?
Well, that I was one of the first original 8 individuals that were part of the Oliver Wyman Health Innovation Center. So mostly I've been aha by what started with just 3 years ago, 8 people, and some of the leadership at Oliver Wyman to something that now is whatever they said it was 500.
550, right?
And so a lot of what I've been thinking about is not really sentimental, but nostalgic, to basically say, we were talking about these things 3 years ago.
Right.
In very
academic, maybe?
Well, not so much academic, but early thought processes. It wasn't well flushed out.
Okay.
And so most of the aha that I've had is how rapidly many of the things that we talked about have come into being, how quickly the industry is shifting from a model that's been focused in World 1 to one that's going to be a consumer focused world. And it's happening with much more rapidity than we actually were thinking about. So part of what my thought process has been related to the speed at which things are changing. And within that, my feeling that most of my colleagues have no idea. So when I go back to my day job, actually expressing this to my colleagues is a very, very difficult proposition, because they don't see it as much in the day-to-day world as I see when I'm coming to something like MediFuture.
Right. Well, I think that, I think the advantage of having you be here from the beginning of MediFuture to today is you have that continuity, and you, I'm sure, will help to drive it forward in the years to come. So I want to thank you so much, Dr. Terrell, for coming here today and visiting with us in the GuideWell Insights Lounge. Look forward to speaking with you again in the future. We'll be up next with our next interview in about another 20 minutes. Thanks so much.
Thank you very much. It's been my pleasure.
Thank you for having me.